Imagine you're in complete darkness. The year is roughly 40,000 BCE, somewhere in what we now call southern Europe. There's no fire tonight. Your group couldn't risk the smoke. The woman beside you has been in labor for 11 hours. She's not screaming. She knows better than to scream. Outside, something large is moving through the brush. She's been through this before. So has the older woman crouched beside her. Hands steady, voice low and rhythmic. There's no boiling water. No surgical steel. No epidural waiting in a bag on a hook. No concept of infection control beyond instinct and experience. What there is, a pair of worn, capable hands, the accumulated knowledge of thousands of years of trial and catastrophic error, and a body that evolved specifically for this moment, and yet, almost uniquely in the animal kingdom, a body that makes this moment genuinely, terrifyingly dangerous. Most animals birth alone. Quickly, quietly, without ceremony. Horses, chimpanzees, wolves, they find a corner and handle it. The infant arrives capable of motion within hours. The mother recovers fast. The species gets on with things. We don't do that. We never have. And that difference isn't incidental. It tells you almost everything about what we are. Here's the question that almost nobody asks when talking about prehistoric humans. How did childbirth actually work? Archaeological records give us tools, migration patterns, burial rituals, cave art. But birth, the single most consequential biological event in any human life, mostly gets skipped. Maybe because the subject is uncomfortable. Maybe because most of the relevant evidence is soft tissue. And soft tissue doesn't fossilize. But what evidence we do have, from skeletal biomechanics to comparative primate behavior to cross-cultural anthropology, paints a picture that should fundamentally reframe how you think about human evolution. Because the story of how our ancestors gave birth is really a story about a catastrophic evolutionary trade-off. One that our species made without choosing it, and one we are still paying for. We evolved to walk upright. That changed our pelvis. Our brains kept getting larger. Those two pressures created what researchers call the obstetric dilemma, a structural conflict baked into human anatomy that makes birth uniquely dangerous among all primates. No other great ape has this problem to the same degree. No other great ape solved it the same way we did. And the solution wasn't medical. It was social, which means the way ancient humans gave birth may be directly responsible for why human societies exist in the first place. Start with the mechanics, because they're stranger than most people realize. About 3.6 million years ago, our ancestors were already committed to walking upright. We know this from the Lead-Ali footprints in Tanzania, pressed into volcanic ash by Australopithecines. Anatomically unmistakable. Trail of evidence across stone. Bipedalism is metabolically efficient. It frees the hands for carrying, for tool use, for gesture. It enables long-distance endurance travel across open terrain. The advantages are real. But bipedalism does something brutal to the female pelvis. When your spine sits vertically above your hips rather than horizontally over four limbs, the birth canal has to accommodate both a narrower outlet and a structural 90-degree turn. A gorilla's birth canal is essentially a straight tube. Ours is a curved corridor with a rotating door. The infant has to navigate corkscrew path through the pelvis, entering facing one direction and exiting facing another. Meanwhile, the human brain kept expanding. Between 2 million years ago and roughly 300,000 years ago, cranial capacity in our evolutionary lineage roughly tripled. Homo habilis averaged around 600 cubic centimeters. Homo sapiens sits around 1,350. That's a dramatic increase in skull size that the narrowed, reconfigured birth canal now has to accommodate. The result: human baby has to rotate mid-delivery, typically emerging face down, rather than face forward like most other primates. It often needs external guidance to navigate safely. And after all that, it arrives at a stage of neurological development that would, in any other mammal, still be considered fetal. Evolutionary biologist Wenda Trevathan has argued that if human gestation were calibrated to produce a newborn with the motor maturity of a newborn chimpanzee, we'd need to be pregnant for somewhere between 18 and 21 months. But the skull would never clear the pelvis. So we're born early, unfinished, completely dependent on others for warmth, nutrition, and protection for months after birth. That early helplessness isn't a flaw in the design. It's the central organizing fact of human social life. Watch a chimpanzee give birth. If you can find the footage, the mother retreats, handles it largely alone, and the infant within hours is clinging, coordinating its limbs, beginning to function. The birth is quick. The recovery is nearly immediate. The social scaffolding required is minimal. Now look at every human culture ever documented. Every single one has some form of birth assistance. Not most, not the majority. Every documented human society, without exception, has a recognized role for someone experienced to be present at birth. The midwife, the elder woman, the specialist, whatever the cultural label, the function is universal. Anthropologists Karen Rosenberg and Wenda Trevathan published a foundational paper in 2002, arguing that habitual birth assistance in humans almost certainly predates Homo sapiens. Their reasoning is structural. Because of the rotational delivery mechanism, that corkscrew path through the pelvis, the infant typically emerges facing away from the mother. In a chimpanzee birth, the infant faces toward the mother, allowing her to reach down, grip the infant, and guide it safely out. A human mother trying to do the same thing would be pulling against the natural curve of the delivery, risking damage to the infant's spine. Human mothers, under standard delivery conditions, cannot effectively assist their own births. The architecture of our pelvis made self-delivery dangerous, which means external help wasn't a luxury or a cultural preference. It was a structural necessity, selected for over hundreds of thousands of years. Once you require another person to be present, everything changes. You need trust. You need someone who has done this before, or learned from someone who has. You need accumulated knowledge about what to do when the cord wraps, when the labor stalls, when the bleeding doesn't stop. You need, in other words, expertise transmitted between generations within a community. Some researchers think this is a key evolutionary pressure behind the female post-reproductive lifespan, the grandmother hypothesis. Most animal species reproduce until death. Human women have decades of post-reproductive life. The standard evolutionary question is, why maintain older females who no longer pass on genes directly? One compelling answer: because a woman with 30 years of obstetric experience is more valuable to her lineage's survival than another pregnancy would be. Experienced grandmothers dramatically increase survival rates for mothers and infants. The knowledge itself became a reproductive resource. The village existed, in some functional form, before the village had a name. What did the physical reality of ancient birth actually look like? What position? What setting? What knowledge base? Here's the honest answer. We're reconstructing from inference more than direct documentation. But the inference draws on a large body of converging evidence from skeletal biomechanics, cross-cultural anthropology, and the earliest written medical records. Position first. Most traditional birth practices across human cultures, and most of the evidence for prehistoric delivery postures, point toward upright or semi-upright positions, squatting, kneeling, on all fours, supported in a crouch. These aren't aesthetic preferences. They have real mechanical advantages. Squatting can increase the functional diameter of the pelvic outlet by as much as 30 compared to lying on your back. Gravity assists rather than works against the process. Mayan birthing practices, traditional Japanese customs, indigenous communities across 6 continents, ancient Roman accounts, the convergence is striking. The supine position, flat on your back with your legs elevated, is largely a modern Western medical invention. Various accounts attribute it to 17th century France, with the claim that King Louis XIV preferred watching deliveries from a comfortable angle. Whether that specific anecdote is historically solid or embellished, the broader record is clear. Horizontal delivery is the historical anomaly. Ancient births likely happened in sheltered areas within the group's living space, near the fire in cold climates, attended by experienced women. With some degree of herbal knowledge, pre-agricultural societies across the world developed sophisticated plant pharmacopoeias, including analgesics, uterotonic compounds that encourage contractions, and preparations for managing hemorrhage. The Ebers Papyrus, an Egyptian medical text dated to around 1550 BCE, but drawing on traditions far older than that, contains specific obstetric instructions, labor induction compounds, treatments for retained placenta, guidance on difficult presentations. This was systematized knowledge, transmitted across generations, adapted to local conditions and local plants. A technology in the truest sense of the word, structured human problem-solving applied to a recurring biological challenge. Now the part that has to be said plainly. Ancient birth assistance was sophisticated. It was socially embedded. It was adaptive in the deepest evolutionary sense. And it still killed an enormous number of women. Skeletal evidence is imprecise, but what remains are recoverable. Evidence of cephalopelvic disproportion, where the infant's head is simply too large for the maternal pelvis to accommodate, appears across the archaeological record. Obstetric fistula, catastrophic injury caused by prolonged obstructed labor, leaves identifiable traces in pelvic bone. It's been documented in ancient Egyptian mummies and in remains from multiple prehistoric populations across continents. Historian Irvine Loudon, who spent decades studying maternal mortality, estimates rates in pre-modern populations in the range of 1 to 2% per birth. That sounds modest until you account for the reproductive context. In hunter-gatherer populations, women typically gave birth between 5 and 8 times across their reproductive years. A 1.5 per birth risk compounds quickly. Lifetime maternal mortality estimates for women who survived to reproductive age in pre-modern populations range from roughly 10 to 15%. First births were the most dangerous. Young women with smaller pelvises, no personal experience with labor, higher likelihood of prolonged obstruction. Skeletal analysis at Neolithic sites like Çatalhöyük in Turkey shows elevated mortality markers in young adult females, patterns consistent with death from reproductive complications. The risks were not metaphorical. The losses were not abstract. And yet populations expanded, which is itself a measure of how meaningful the communal support structure was, not perfect, not sufficient to prevent the deaths, but enough to keep the survival rate above the replacement threshold. There's a version of this history that certain communities have started telling with increasing confidence, that ancient and traditional birth was somehow purer, more attuned, more aligned with human nature than the medicalized version we have now, that we've lost something essential by moving birth into hospitals and clinical settings. Worth pushing back on that. What the ancient record actually shows is that our ancestors did the best they could with what they had, under conditions of genuine and significant lethality. The communal structure was real and meaningful. The transmitted knowledge saved lives. But those things coexist with the fact that without modern intervention, certain obstetric emergencies, placenta previa, severe preeclampsia, uterine rupture, cord prolapse, have no resolution. They simply kill. In countries where modern obstetric care remains inaccessible today, maternal mortality rates of 500 to 1,000 per 100,000 births are still recorded. With access to modern care, that figure drops below 20. The romanticization of ancient birth selects its evidence carefully. It highlights the communal warmth and ignores the burial mounds of young mothers. It celebrates the herbal knowledge and skips the cases where the knowledge ran out. What's genuinely worth recovering from the ancient model isn't a method. It's a framework. The understanding that birth is not a sterile, isolated medical event to be managed by one specialist behind a curtain. It's a moment of profound vulnerability that is managed best when there is presence, continuity, trust, and transmitted experience in the room. That insight, which is what the ancient communal birth structure was built on, still holds. Modern obstetrics gives you a crash cart. The ancient framework gives you a community. The mistake is thinking you have to choose one over the other. Go back to that darkness, that shelter, somewhere in Pleistocene Europe, the brush outside, the experienced hands inside. What that scene represents isn't primitive. It's the prototype. It's the moment where human social bonding shifted from being useful to being structurally necessary. Because a species that requires communal assistance at the moment of birth has biologically committed itself to interdependence in a way no other animal has. Every other social species can, in extremity, function alone at its most critical reproductive moment. We cannot. We were built to require each other not from childhood onward, but from the first breath. The helpless newborn doesn't become a social creature through culture. It arrives as one, already structured to require the presence and coordination of others simply to survive the first hours of life. The obstetric dilemma created something in exchange for the danger it imposed. It selected for social intelligence, for the cognitive architecture needed to establish trust with another person, defer to expertise, transmit complex knowledge across generations. A species that had to organize communal support around birth had to develop theory of mind sophisticated enough to coordinate that support, had to develop language precise enough to encode obstetric knowledge and pass it reliably to the next generation, had to build social structures stable enough to sustain that transmission over lifetimes. The grandmother who has attended 40 births, the young woman beside her, watching, learning, the group alert to what's happening in that corner of the shelter, organized around that single vulnerable moment. This isn't just reproductive biology. This is civilization in its earliest recognizable form. Our brains got too large for our pelvises. That sounds like a design failure. What it actually produced was the first indispensable human institution, the gathering where knowledge moves between bodies, where one person's vulnerability becomes the responsibility of many, where survival depends not on individual capability, but on collective intelligence organized around care. The birth canal is, when you look at it the right way, an argument for human society itself. We've come measurably far from that shelter. Maternal and infant mortality rates are lower now than at any documented point in human history. And that matters. That deserves to be said without apology. But strip away the technology and the clinical setting, and what you find underneath is ancient architecture. The need for presence, for experienced hands that have done this before, for trust built in advance of crisis, for knowledge transmitted person to person across generations. That structure hasn't changed because it can't change. It's load-bearing. It's what we're made of. If this was worth your time, share it with someone who thinks they already know where humans come from. And if you want more of this, biology, psychology, and deep history colliding into something that actually changes how you see the present, subscribe. There's a great deal more to unpack.